Let's move now to learn a little bit more about contact tracing. We have a contact tracer who we're going to bring in here in a moment. Let's actually go to Mitch. Mitch, you on there?
Yes, hi, Governor. Happy to be here.
Mitch, Dandurand is the epidemiologist at Lorain County Health Department. He's been working there for 4 years, I believe, and you're getting a workout in the last 6 months or so. It's a little different world, but can you just, for somebody who's watching this today who has no idea what you do, can you kind of take them through the process from the beginning, and then just kind of information comes in from the time it maybe comes into the health department, you take it and you go from there?
Absolutely. Yeah, certainly did not expect a pandemic within my first couple of years of working in a local health department, but Kent State got my mindset right, and I'm ready for anything coming out of there, so I can attribute that to them. As for contact tracing, it's a pretty straightforward process. We get a notification of a confirmed lab, and our first course of action is to identify how we can reach that person. A lot of times that's reported by the lab, and that's a simple phone call. And first and foremost, when they do answer the phone, you want to make sure that they're medically fit to complete an interview. You don't want to exacerbate somebody that's already extremely sick. So some cases have mild symptoms, others have very severe symptoms. So we kind of use our best judgment to see if that person is medically fit to give up the information that we need. And then from there, once they say, I'm good, we can do this, we are very straightforward with what we intend to do with this interview, what we intend to do with the information that they give us. That way they have it in their head throughout the interview of, this is why I need to answer these questions in a forthcoming manner. So once that's all established, we go right into establishing a time frame for this individual in which they were infectious. So how we do that is we ask when they first started to feel ill and what those symptoms were. And once we get that date of symptom onset, we can establish that infectious period. And once we have that time frame, we reiterate to them. So, okay, so we're going since September 2nd, keep that date in your mind. And as we move forward with this interview, we're going to try to identify anyone you exposed. And then we go over the definition of exposure. That's very important to know what we're looking for, them to know what we're looking for. So once that time frame's established, once that definition is clear in their head, we move right into it on trying to figure out who they may have exposed. We start with the household contacts. That's pretty straightforward. Workplace contacts, when was your last day at work? What did that last day at work look like? Is your employer aware? Do you have any other cases at work? And then we move on to the community exposures, those that they may have exposed in a more casual setting, whether it be through a lunch, a family gathering, churches, anything like that. So we got those 3 levels of which they could have exposed anybody. And then we kind of follow up that interview with a 2-week history. This is the more complicated part, but this helps us establish links with any outbreaks that may be going on, establish a link with a known case that we have on file. Really helps the health department learn how this is being transmitted throughout the community. But basically what we tell them when you say, when you're going to give us some information, here's exactly what we're going to do with that information. So those people that come up as exposures are actually forwarded down to a different team of ours. We have the interview team that gets that information, and then we have another team that reaches out to those that were exposed and informs of their exposure, remaining confidentiality, very important for the case. But also it gives these people a time frame of what they should be looking at. And the people making these calls to those that are exposed are tried and true professionals. They have been on the front lines of COVID since March. So they're experienced with this pandemic as anybody else in Ohio at this point. So we have a really great professional reaching out to you and letting you know of all these steps that you should be taking for how long. And this is what you should do to protect your family, your community, and your workplace. if they want to sign up for a system where they report symptoms to us, that's easily done through a text messaging system developed by the state health department. If that really helps with data collection. It helps us determine on when it's safe for them to return to work, whether or not they should be tested. So it helps get some information on that individual, and we can just consult and guide from there. So that's kind of how the process works.
Yeah. So when you're talking, let's go back to you. When you're talking to the person that has tested positive, and you're now trying to determine, who might they have infected, what are some of the variables, the criteria? I mean, length in time they're with somebody, and I mean, how do you just maybe give us a couple of examples of maybe an example of where you assume it's not an infection, or and then maybe where you would assume it was and pass that name then on to the next person on your team?
Absolutely. Our interviewers are very experienced. We try to say, you got to get the details on all of these exposure settings. So that's exactly right. The length of time, whether or not there's a mask worn, any direct contact. So when we tell them, this is what we're looking for relative to your symptom onset date. So we got your symptom onset date. Let's go 3 days prior to that. That's when what we call the pre-symptomatic phase, and people are spreading it pre-symptomatically. They don't know they have it. So we're going to go 3 days from your symptom onset. We're going to define close contact as anyone within 6 feet of you for 15 minutes or longer. And then we're going to get some context behind that interaction. Were you there all day? Did you make direct contact? Did you have a mask? And that way, if we get in those situations where we're not sure the degree of exposure, the team can talk about it. The team can reach out to the individual, get their side of the story. But yeah, basically the definition of close contact is that 6 feet within that time frame, with or without a mask. So it's just a lot of details behind the exposure that we collect and we look at.
So every case is kind of fact specific, I guess.
Exactly. And that's why it's tough to come up with some written protocol, some very black and white directions. We've tried that since the start. And as soon as we do it, a case comes and blows the whole thing to pieces. So that's just kind of the nature of it. You got to be quick on your feet, and have a team that's willing to consult with you and really go over the information together.
And the factor, explain to me, as a professional who's done this now an awful lot of times, explain to me the factor of time, how long it might be exposed to somebody. How does that factor in, and what are some of the other factors?
So we use that contact definition that was from the state. So that factor of time. Now, if someone's with someone all day intermittently, it's really tough to say cumulatively, were you exposed for 15 minutes? Were you there for 15 minutes within 6 feet? So again, it's all about those details. And what we find is those that spent the day together and try to keep their distance and everything, we might not see really a high risk situation there, but spending time in someone's household, that's a different type of exposure, especially if the case lived there. So those are all the factors that contribute to that time frame we look at.
Okay. Well, Mitch, thank you very, very much. Good luck to you and everyone who else is out there that's engaged in this. We appreciate your work. We know it's not easy, and thanks for doing it. Good luck.
Thank you, Governor.
Thank you. Appreciate it.